Throat cancer is a type of cancer that develops in the tissues of the throat, which includes the pharynx, larynx, and tonsils. It can also affect the voice box and the esophagus. This complex and potentially life-threatening condition affects thousands of people worldwide each year, impacting their ability to speak, eat, and breathe normally. The throat is a muscular tube that starts behind the nose and ends in the neck. There are two primary types of throat cancer: pharyngeal cancer, which affects the pharynx, and laryngeal cancer, which affects the larynx, commonly known as the voice box, and it plays a crucial role in breathing, talking, and swallowing. The prevalence of throat cancer varies depending on the specific type and location. In general, throat cancers are relatively uncommon compared to other types of cancer. However, they still affect a significant number of people. For instance, in the United States, it's estimated that about 12,000 new cases of laryngeal cancer and 17,000 new cases of pharyngeal cancer are diagnosed each year. Causes of throat cancer. One of the primary risk factors for throat cancer is tobacco use, including smoking cigarettes, cigars, or pipes, and using smokeless tobacco products. The harmful chemicals in tobacco can damage the cells in the throat, leading to mutations that may eventually develop into cancer. The risk increases with the amount and duration of tobacco use. Alcohol consumption, particularly heavy drinking, is another significant risk factor for throat cancer. Alcohol can irritate the lining of the throat and interfere with the body's ability to absorb certain nutrients that may protect against cancer. The combination of tobacco use and alcohol consumption significantly increases the risk, as these substances have a synergistic effect in damaging throat tissues. In recent years, human papillomavirus, HPV, infection has been recognized as an increasingly important cause of certain types of throat cancer, particularly those affecting the oropharynx. HPV is a common sexually transmitted infection, and while most people clear the virus without any problems, in some cases, it can lead to cellular changes that may eventually result in cancer. Other risk factors for throat cancer include a diet low in fruits and vegetables, which may deprive the body of important antioxidants and nutrients that help protect against cancer. Occupational exposures to certain substances, such as asbestos or wood dust, can also increase the risk. Additionally, gastroesophageal reflux disease, or GERD, which is a condition where stomach acid frequently flows back into the esophagus, may contribute to the development of throat cancer in some cases. Symptoms of throat cancer. The symptoms of throat cancer can vary depending on the specific location and stage of the cancer. In the early stages, throat cancer may not cause any noticeable symptoms, but as the cancer progresses, symptoms become more apparent. One of the most common symptoms of throat cancer is persistent hoarseness or changes in the voice. This is particularly common in laryngeal cancer and can feel like a constant sore throat or the sensation of having something stuck in the throat. As the cancer progresses, individuals may experience difficulty swallowing, also called dysphagia, which can feel like food is getting stuck in the throat or chest. This can lead to unintended weight loss as eating becomes increasingly challenging. Pain in the throat or neck is another potential symptom, which may be constant or occur only when swallowing. Some people describe this as a burning sensation or a feeling of pressure. In some cases, throat cancer can cause ear pain, particularly when swallowing, due to shared nerve pathways between the throat and ears. Visible lumps or swellings in the neck, which may be painless, can be a sign of throat cancer that has spread to nearby lymph nodes. These lumps may be noticed by the individual or discovered during a routine physical examination. In cases where the cancer affects the nasopharynx, symptoms may include frequent nosebleeds, hearing loss, or a sensation of fullness in the ears. Some individuals may also experience difficulty breathing through their nose or notice changes in their sense of smell. As the cancer progresses, more severe symptoms may develop. These can include difficulty breathing, which may be accompanied by noisy breathing or wheezing. In advanced stages, some people may cough up blood or experience persistent coughing. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of throat cancer. The diagnosis process usually begins with a thorough medical history and physical examination. The doctor will ask about symptoms, risk factors, and family history, and will examine the throat and neck for any abnormalities. If throat cancer is suspected, the next step is usually a laryngoscopy or pharyngoscopy. This involves using a thin, flexible tube with a light and camera called endoscope to examine the throat more closely. This procedure can be done in the doctor's office and allows for a detailed view of the throat tissues. In some cases, a special dye may be used to help highlight any abnormal areas. If any suspicious areas are identified during the endoscopic examination, a biopsy will be performed. This involves removing a small sample of tissue for examination under a microscope. In some cases, a fine needle aspiration biopsy may be done to sample tissue from a suspicious neck lump. Imaging tests are also an important part of the diagnostic process. These may include computed tomography scans, magnetic resonance imaging, or positron emission tomography scans. These tests help determine the extent of the cancer, whether it has spread to nearby tissues or lymph nodes, and assist in staging the cancer. Throat cancer is categorized into 4 main stages, each indicating the extent and spread of the cancer. Stage 1 is where the cancer is confined to the part of the throat where it started and is relatively small, usually 2 centimeters or less, without spreading to nearby lymph nodes or distant sites. In stage 2, the cancer is larger than 2 centimeters, but not larger than 4 centimeters, and may have spread to a nearby area within the throat, but still hasn't reached the lymph nodes or distant sites. Stage 3 indicates the cancer is larger than 4 centimeters or has spread to a nearby lymph node, with the affected lymph node being on the same side of the neck as the cancer and no larger than 3 centimeters, without spreading to distant sites. Stage 4 is when the cancer has spread to other tissues in the neck, to more lymph nodes, or to distant parts of the body. This is called metastasis, and this stage is further divided into 4A, 4B, and 4C, indicating increasing severity and spread. Treatment for throat cancer. Treatment for throat cancer depends on several factors, including the specific location and stage of the cancer, the patient's overall health, and personal preferences. In general, treatment typically includes surgery, radiation therapy, chemotherapy, and targeted therapy. Surgery is often a primary treatment for throat cancer, particularly in early stages. The extent of surgery can vary widely, from relatively minor procedures to remove small tumors to more extensive operations that may involve removing part of the voice box or pharynx. In some cases, reconstructive surgery may be needed to help restore function and appearance after cancer removal. Radiation therapy uses high-energy beams to kill cancer cells. It can be used as a primary treatment for some throat cancers, particularly those in areas that are difficult to access surgically. It's also commonly used after surgery to kill any remaining cancer cells. Advanced radiation techniques, such as intensity-modulated radiation therapy, allow for precise targeting of the cancer while minimizing damage to surrounding healthy tissues. Chemotherapy involves using drugs to kill cancer cells throughout the body. It's often used in combination with radiation therapy for more advanced throat cancers. Chemotherapy can be given before surgery to shrink tumors, making them easier to remove, or after surgery to kill any remaining cancer cells. Targeted therapy is a newer approach that uses drugs or other substances to identify and attack specific cancer cells while doing less damage to normal cells. For example, cetuximab is a targeted therapy drug that can be used to treat some types of throat cancer. After completing initial treatment, patients typically require regular follow-up appointments to monitor for any signs of cancer recurrence and manage any long-term side effects of treatment. This may involve ongoing speech and swallowing therapy, nutritional support, and sometimes additional reconstructive procedures. Now, we want to hear from you. Do you or someone you know have throat cancer? What symptoms did you have? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.